Hello, I'm Alex Metricardi, Chief Marketing and Public Relations Officer for Living Branches. Today is July 16th. I'm here today with Ed Brubaker, our Living Branches President and CEO. It's been a while since we've done this.
Yeah, it has been a while. How long has it been, actually?
Mike, our photographer, tells us the last time we filmed, he believes it was June 11th.
Wow, so about a month.
Yeah.
I think that is an illustration of kind of what's happening. There's, I was going to say positive things happening, and that is true, it's positive, but negative tests, positive things.
Yeah.
So, yeah.
It is positive. We do not have anybody, staff or residents, with COVID on our campuses right now. And it's been that way for a couple of weeks, I believe, at least.
Yep.
So that's nice to see. I think that in our conversations in our coronavirus response team meetings, we would tie that directly to the fact that we've got some pretty good vaccination rates.
Yeah, there's no question about that. And the vaccination, I think, has made such a difference over the last number of months. And it's really pushed down the positivity rates in Montgomery County. Montgomery County and Bucks County track pretty close together. This week they did both go up 0.2% after going down 0.2% last week, but they're both still under 1%. So I think Montgomery County was at 0.6 and Bucks County at 0.7 this week when we checked. And so the concern is it did creep up, but it was all after going down to the low point of 0.4 and 0.5. So what that means in the long term, we don't know. But we obviously pay attention to that stuff. But at the end of the day, what we have found over this period of time is the county positivity rates can be the biggest indicator of what will happen within Living Branches. Obviously, we'd like to think we're so good that we don't track with that, but the reality is we're part of the counties, and if the county rates are low, our rates are low. If the county rates go higher, our rates tend to be higher. Having said that, the vaccine has made such a difference for our residents and for our staff.
Yeah. And we are keeping with our commitment of reporting our vaccination rates for staff persons on our website. So all of that is on our coronavirus page if people want to see that. But we're tracking at 79%, I think, overall right now.
We've kind of varied. Part of it is, people start, they stop employment, and so that can make a difference. But we've been tracking right around overall 79 or 80%. Now, interestingly enough, the areas that are most challenged are healthcare at Souderton, healthcare at Dock, personal care at Souderton, personal care at Dock.
Yeah.
And so it's just fascinating to me that in the areas that were, particularly healthcare, that were probably the hardest hit are also the ones. So I don't know if that's partly because staff persons may think I survived that, I'll survive anything, or what are all the different reasons for that. But it is kind of fascinating to look at that. But overall, 79 and 80%. And I would say, I'd love it to be better. Absolutely love it to be 85 or 90%. It is good, though, compared to others in our industry and other industries. I was just speaking with a person in the Lancaster area this morning, and overall they were about 69%, which again is not awful, but it's not where we want to be. And so we continue to like to keep pushing that bar up and keep pushing the numbers up, but we also feel pretty good about where we're at.
Yeah, definitely. We met yesterday in our coronavirus response team and updated a little bit of guidance that I think I will probably attach to this email when we send it out to families and to residents so that they can read more about it. But maybe we could highlight some of the things that are happening on campuses right now, because we really have opened our doors significantly compared to where we were even a couple of months ago. And when you reference the fact that the positivity rates in the surrounding counties have so much impact on us, it's easy to see why, because we have visitors coming back to campus and doing all sorts of things, including if they are vaccinated, they're able to eat in the bistro or cafe with their loved ones. We have healthcare residents, personal care residents, memory care residents are able now to go more out to family gatherings. So it's starting to feel, I don't like to use the word normal, but it's certainly starting to feel more like that.
Yeah, it definitely is. It feels so much better than last year. There are still risks involved, and we'll probably talk about some of those later in the video. But yeah, there's things that are so much better. But we also are differentiating between vaccinated and unvaccinated. And again, the reason for that is it's proven that the vaccine makes a difference. The people are in the hospital today in Mississippi, in Missouri, and other places. Vast majority of the people that are really sick and in the hospital are unvaccinated persons. And I think people that are unvaccinated watching this video need to think about that and say, is that the risk I want to take? And so those are the facts. So that's why we do differentiate between vaccinated and unvaccinated, whether it's in masking policies at times or, persons who can come on campus, because we still serve the population that was the hardest hit. It's also the population that has probably the best vaccine participation rates, 90 to 100%. And we have some of our facilities that are 100% vaccinated. So that is wonderful, but that makes the difference. What we don't know is how long it lasts. And there's been debate, and I won't get into all those things. You can read the stories as well as me. But the question is, for a senior, for an older person, does the immunity last as long as it does in a younger person? And that's, kind of the $1 million question of the day. We're not sure yet, but we need to keep watching that. People are talking about boosters, et cetera. We're not anywhere close as Living Branches to be able to talk about that yet. But it's things we think about because we want to do the things that will keep us safe in the long term and allow us to continue to function at these levels, because none of us want to go back. No. Because frankly, if we have one case, it potentially causes us to shut that level of care down.
Yep.
That rule has not changed. We've just been fortunate that we haven't had cases. The rules for personal care and health care in that regard haven't changed.
That's an interesting point, because one of the questions that I do get asked by family members, especially family members in, say, personal care, memory care, health care, is they will say to me, why do I have to wear a mask when I am visiting with my loved one? I'm in their room, they're vaccinated, I'm vaccinated. Why are you making me do this? And I think making sure that people understand that one case shuts everything down. I mean, we are operating out of an abundance of caution, no question, in that particular area.
Yeah, and those particular things we'll continue to evaluate too, because again, if both are vaccinated, we need to continue to look at those things. But it absolutely is no question why masking, and LA County, I'm sure people have read in the news that because of the increasing rates in LA County, they are now going back to requiring masking inside for vaccinated and unvaccinated persons. And part of that too is like, how are you going to track who is and who isn't? And frankly, people aren't always forthright in that. And so it makes sense that everyone needs to be. But that's an example of going in a direction that nobody wants to go in. Having said that, I would have to observe that wearing a mask is a small price to pay for the safety of others. And that's probably, for me, one of the things that's been a head scratcher, frankly, through this whole time. The way we as Americans have equated that to infringing on our freedom. It's just fascinating to say how quickly we can go to that. And I view it as caring for self and caring for others. I know people may disagree with that, but that's really how I view it. And are we willing to make those sacrifices? But we don't want to have to go back to more restrictions. But we feel like the process we've gone through is a thoughtful one, and frankly, not one we know that everyone's going to agree with, but that's okay. This is the direction we're forging, and not everyone has to agree. That's perfectly fine.
Yeah. The question about variants is coming up more and more, and I have had residents asking me, what do you know? Do I need, as you said, do I need a booster? Am I protected? And I guess maybe there's a lot of answers that we don't know because no one knows. But maybe just to let people know, we are keeping our eye on that, if you will, and doing research.
Yeah, absolutely. We watch that, and I am not the expert. I leave the science to the scientists, and they don't need to tell me how to run a retirement community, and I won't tell them how to do their science. But at the end of the day, we do need to pay attention to that, to read what are they seeing. And it's not clear yet where all this is going, but we absolutely are paying attention to it. But it would appear that there's still a very strong measure of immunity that the vaccine gives to the variants as well. But again, how long it lasts and those kind of things, but we'll need to keep paying attention to it. But the key is, again, getting to that herd immunity, because frankly, if you get to the place where the virus doesn't have a host, that's the whole point of this. We don't have to worry about variants as much if we get to the place that there's no hosts.
Yeah.
And the problem is, because we don't have herd immunity yet, there's still too many unvaccinated people that are hosts to this virus. And so that is also why some of these other things will be needed potentially, is if we don't get to elimination of the host, and that is the thing that the vaccine can do. And I would just encourage people to read the science, do the right thing, and obviously in my mind the right thing is to get vaccinated.
Well, and to be careful when you're traveling.
That's right.
Because Montgomery County does have I think we probably are at herd immunity in Montgomery County.
Right.
But a lot of people are going to Florida, and a lot of people are traveling this summer.
That's right. And I'm vaccinated. I did some traveling in June. And frankly, I have a measure of confidence because of the vaccine. Yeah. But, they still require masks on airplanes and in airports. And I support that. Why not? What's the big deal? Let's just do it. Let's not make it into this big issue. Let's just do it. Yeah. It feels like we're kindergartners instead of adults sometimes. So let's be mature, care for each other, care for ourselves.
That sounds like a very good closing line.
Yes,
should we go with
good.
that? Did
Sure,
you have
absolutely.
anything else you'd like to
care
add?
for ourselves and care for others. And if we use that as a guiding principle, I think we can reduce our anxiety, to show love and care to others, and to reduce the bickering about things. If we have a principle of using the litmus test, does this care for me and does it care for others? Yeah. I guess that's kind of the golden rule too, right?
Absolutely.
So let's get back to the basics and use that as the litmus test, as opposed to the many other things that are being used as a litmus test today.
Yeah. Thank you.
You're welcome.
Thank you to you for watching. If you have questions, please feel free to email them to coronavirusquestions@livingbranches.org. And of course, information is always on our website at livingbranches.org. Thank you.